On May 27, 2014, an 18-year-old Ohio teen, Logan Steiner, died of what seems to be a caffeine overdose, according to health officials. After Steiner's death, his mother found bags of caffeine powder in his room. ABC News reports the high school senior from LaGrange, Ohio, had about 70 micrograms of caffeine per milliliter of blood in his system, according to Lorain County Coroner Stephen Evans. A typical coffee drinker would have about 3 to 5 micrograms. Today I'm going to explain what caffeine is, how it affects the central nervous system, explain some benefits of caffeine, and explain how caffeine affects your sleep. Caffeine is the most widely consumed drug in Western society, according to the Journal of American Dietetic Association. The Merriam-Webster Dictionary defines caffeine as a bitter alkaloid found especially in coffee, tea, cacao, and cola nuts, and is used medicinally as a stimulant and diuretic. Caffeine is used as a stimulant to keep you alert and awake. The Food and Drug Administration considers caffeine both a food additive and drug. Caffeine can be lethal if ingested in large amounts. Caffeine comes in many forms, including coffee, tea, soda, energy drinks, and even over-the-counter medicine. According to the University of Michigan, caffeine may increase heart rate, body temperature, blood flow to the skin and extremities, blood pressure, blood sugar levels, stomach acid secretion, and production of urine. People may experience dizziness, hypoglycemia, fruit-like odor, trouble breathing, muscle tremors, nausea, diarrhea, increased urine, ketones in urine, drowsiness, thirst, anxiety, confusion, irritability, insomnia, changes in appetite, dry mouth, blurred vision, and cold sweats. Next, I'm going to tell you about the effects that caffeine can have on the body. First, I'm going to discuss how caffeine affects the central nervous system. Caffeine is a central nervous system stimulant. The central nervous system consists of the brain, spinal cord, and other nerves in the body. According to Washington.edu, caffeine belongs to the xanthine chemical group. Adenosine is a naturally occurring xanthine in the brain that is used as a neurotransmitter at some synapses. One effect of caffeine is to interfere with adenosine at multiple sites in the brain, including reticular formation. Caffeine also acts at other sites in the body to increase heart rate, constrict blood vessels, relax air passages, to improve breathing, and allow some muscles to concentrate more easily. This is how caffeine keeps you alert. I am now going to explain some surprising but relieving facts about moderate caffeine intake. Though caffeine can be deadly consumed at extreme levels, moderate caffeine intake is almost without long-term risk to the body on a healthy adult. Some surprising yet relieving facts about caffeine risk have come to light from a study conducted by the Journal of American College of Cardiology, which studied the effects of caffeine through coffee consumption. The study suggests drinking up to 6 cups of coffee a day will not increase your risk of increased blood pressure on a long-term basis. According to the study, caffeine does not seem to have negative effects on blood sugar. Coffee even contains antioxidants that may help reduce the risk of type 2 diabetes. The Journal of American College of Cardiology also did a study on the cardiovascular effects of caffeine, which suggests in moderation, caffeine may decrease the risk of heart disease and stroke. Lastly, I'm going to inform you on the effects caffeine can have on the quality and quantity of sleep. A study conducted by Michigan's Henry Ford Hospital Sleep Disorders and Research Center and Wayne State College of Medicine compared 12 adult men and women's sleep schedules with the timing of their intake of caffeine. The study suggests caffeine consumed 0, 3, and 6 hours before bedtime significantly reduced the total time of sleep. Even caffeine consumed 6 hours before bed reduced total nightly sleep amounts by more than 1 hour. Caffeine consumed at all points diminished sleep quality. Caffeine taken 3 and 6 hours before bedtime, as well as caffeine consumed at bedtime, significantly increased the amount of time spent awake during the night. Disruptions to sleep as a result of caffeine were perceived by volunteers as recorded in their sleep diaries, for caffeine consumed at bedtime and 3 hours before bed, but were not reported for caffeine taken 6 hours before bed. However, sleep monitors measuring total sleep time and sleep efficiency showed that caffeine consumed 6 hours before bedtime had significant detrimental effects on both. In conclusion, although caffeine can be lethal, like in Logan Steiner's case, consumption at a moderate level is almost completely harmless to the body on a long-term level. There are some risks, just like anything we put in our bodies. Do I have any questions?
What is the recommended daily amount of caffeine?
The Mayo Clinic suggests we consume about 400 milligrams of caffeine, which is equivalent to about 4 cups of coffee or 10 cans of soda a day.
When should you stop drinking caffeine in order to get a good night's sleep?
Studies suggest we stop caffeine intake about 6 to 7 hours before bedtime in order to get the maximum amount of sleep.